Well, from battling a heroin epidemic to HIV cases, they are among the top of the nation. Baltimore has its hands full when it comes to dealing with health issues. But the new leader at the health department is up for the challenge, and she's one of the best and brightest. Kelly Swoop is here with more on her one-on-one interview.
Jamie, by now you've seen Dr. Leana Wen all over Baltimore. The new city health commissioner hit the ground running with everything from that measles outbreak to the flu and all these vaccine controversies capturing the headlines.
Measles is one of the most contagious diseases in the world. The silent killer that is heart disease. But also when it comes to deaths from HIV.
In front of the cameras, in the spotlight, she hit the ground running. But behind the scenes, Dr. Leana Wen is still walking into her new role as the city's top doc. So new on the job, she was still waiting for her nameplate. Born on the other side of the world, the Chinese immigrant and her family moved to the U.S. on political asylum when she was just 8. 10 years later, by the time she was 18, she'd already graduated from college. While our new commissioner is a long way from home, she has a lot more in common with Baltimore than you may think.
I grew up in poor inner cities of Los Angeles, not too dissimilar to Baltimore. So even though I haven't lived in Baltimore before, this is an area that I feel like I know. I grew up in Compton, I grew up in East LA, and I saw every day what happens when people don't have access to healthcare and make choices between food and medicine, between rent and getting their kids to school.
She knows the problems because she's also been on the front lines, working in the ER at George Washington University Hospital.
We in Baltimore, just like everywhere else in Maryland and everywhere else in the country, are seeing a rise in the number of people who are dying because of heroin overdose. That's a completely preventable tragedy.
Wen supports the use of the life-saving drug Narcan.
We need to identify where are people dying, why are they dying, and how can we get first responders, but also family and friends trained so that we can save people's lives.
Quality patient care. That's also near and dear to Wen. In 2010, she lost her mom, Sandy, to breast cancer.
By the time that she was diagnosed, she already had cancer that had spread to her lungs and her bones and her brain. And being her caregiver for 8 years while she was going through her cancer treatment taught me a lot about the disconnect that happens between what it is that medicine does and what it is that patients experience.
Wen says she's who she is today because of her strong family and role models like former Mayor Kurt Schmoke and her predecessors, Doctors Peter Bielenson and Joshua Sharfstein. But she worries, though, for kids who don't have that influence.
I see kids now in Baltimore and around the country who we talk about STIs, we talk about HIV, we talk about other health issues. They can't see beyond survival the next day. They can't see beyond survival until they're 16 or 20. What's the use of talking about all these other things if we can't address safety? In the communities that I grew up in, my friends and my classmates were often the victims, but also often the perpetrators of gun violence and of violence in general. And in working in the ER, I see this too, that the patient who comes in with stab wounds and with gunshot wounds also was probably here 2 weeks ago.
It is a cycle of problems we have to break.
These are the big problems, and somebody has to take ownership. And even if we can't solve them today, I'm going to take ownership. We as a team are going to take ownership and take steps to really make Baltimore stronger and healthier.
Dr. Wen also loves patient care. She doesn't want to lose that with her new role, so she's even gotten her license to practice in Maryland, and she hopes to volunteer in local emergency rooms, so she says she can really understand some of the public health challenges that people face here firsthand.
She's hired. What a woman, huh?
It's a dream job, she said.
I know all the heavy stuff, but does she like to have fun?
I interviewed her for an hour, and that was the only question that stumped her. What do you like to do for fun? She says she's boring. She likes to read. She likes to write and spend time with her husband. But I had her take me back a couple years. Take a look at this. She used to be a professional ballroom dancer. Latin dances, swing, and tango, foxtrot. Now she says she's hanging up a professional hat and she just likes to dance for fun.
Wow. Where will she be dancing this tomorrow night?
Probably in one of the emergency rooms.
Yeah, right.
You know, she's just she's a good asset. Good to have her.
I think she gets us.
I think she does.
All right, Kelly, thank you.